I too support the bill. I'm grateful for what's in the bill. I'm disappointed in some of the things that aren't in the bill: daycare, long-term care, people who desperately need help. A lot of the renters and the homeowners who are paying mortgage who haven't been able to pay the mortgage or pay the rent, who are protected right now, but soon will lose those eviction moratorium protections. They won't have the ability to pay the back rent. We'll be homeless. Very disappointed we couldn't do anything for any of them, but grateful for what we have done in here. It may not be enough to help the businesses. It may not be enough to help child care, who's not getting anything out of it. May not be enough to help the schools reopen right away. But I'm glad we're doing it, and this is, as I think Senator Anderson said, a lifeline for these businesses, something that may help them keep their heads above water. And as he mentioned, some of them aren't going to make it. Some of them have already gone under, and they won't be coming back, he said. And that's true, unfortunately. Those 4,500 Minnesotans who have died from this, they're not coming back either. And they matter too. I don't think there's a person in this room who doesn't know some people that they loved and cared about who haven't died from this. I'm thrilled that most of the people who get it survive. They say something like a third of the death notices in the paper these days are from COVID. That's on top of everybody else dying. And those matter too. Boy, I want their schools to open for teachers' sake, for kids' sake. I want our restaurants and hospitality industry to open now, as soon as possible. But not if it's going to mean a lot more people dying. Because some of those restaurants, the ones that go under, boy, some places I really love have gone under. I do hope they'll find a way to come back. I don't know if they will. But I can tell you those 4,500 Minnesotans aren't coming back. And so I'm a little bit bothered by some of the rhetoric about the governor not doing anything. If he would let us talk with him, if he would let us do this, maybe we could save those businesses. Well, I'm not sure anybody in this room has the wisdom to know how we're going to make sure we can open up everything. The one thing I know we can do is take the precautions we're warned about. If we want to look at this, we've got a president of the United States who's on the way out. But for months he was saying this was a problem. COVID was just going to go away, magically go away. It wasn't a huge problem. We've heard people even here saying it's no worse than the flu. Well, not that much higher of a percentage die from it maybe, but 4,500 Minnesotans have died from it. And ridiculing mask wearing, I look around the chamber now, we're doing a lot better than we were a few months ago. But when we had people like the President of the United States, who nobody's mentioned today yet, who was ridiculing people for wearing masks, who was attacking them for it, who was saying you don't need them. I don't know of any public health official in the state or country who is saying right now masks don't help protect against spread of COVID. And if we want to open up these restaurants and the schools and everything else that we care about, if we want to be able to go visit our kids and our grandkids, if we want to have a normal life, we got to get this thing under control. So this bill is a good thing today. Thank you for pushing it. Thank you for bipartisan agreement on this. But let's not pretend that we're doing this because the governor caused this problem, because the governor didn't cause this problem. Plenty of people, I could argue, made it a lot worse than it needed to be. And I do hope we don't lose more restaurants and bars. I do hope we don't lose more small businesses. Wish we could do more for them and for the workers who are unemployed. Wish we could do more every step along the way. But the one thing I do know is if we take the precautions the public health experts say, we have fewer dead people and fewer closed businesses. So I urge us to pass this bill, but let's be careful when we're attacking the governor as if he's the one who caused this. He's been doing a better job than a lot of governors have. He's been working very hard listening to public health experts, trying to save lives. If we care about lives, which every one of us will say we do, now let's care about them. Let's try and make the actions, because unlike these restaurants, those folks aren't coming back. And I know if we want the businesses to reopen soon, the faster we get this thing under control, the faster we get our healthcare workers in a safe position. Yes, vaccines are coming, but Dr. Osterholm said the other day again, he said, yes, don't see that as a panacea. The thing we do know works is wearing masks and taking social distancing. So let's do our part about that instead of attacking others who are trying to do it through logical and attempts to be as scientific as possible in what we close, recognizing the harm, economic harm, recognizing the loss of social life and the loss of business, economic activities, but also recognizing that we as people can do certain things to help control this, and that in the end is going to be the biggest solution to this, not just the vaccine, but our behavior and that. So please vote for the bill, but recognize that we're going to have a bad problem, and the bill won't do enough to make up for all the harm that is inevitable given the crisis.